This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Is there a DPC clinician, tech vendor, or industry champion that goes above and beyond to further elevate the DPC movement? Nominate them for a DPC Innovation Award to recognize them for creating traction, embracing innovation, and demonstrating commitment to the movement. DPC Innovation Award winners will be announced and honored at this year's Hint Summit, taking place in Denver, Colorado, September 27th through 28th. Nominate a DPC innovator at summit.hint.com, plus get $50 off your Hint Summit 2024 registration with promo code MyDPCStory. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct primary care is an innovative and yet simple model of healthcare in which both the physician and the patient thrive. In the more common insurance-driven healthcare system, primary care doctors are tasked with an impossible job. This job requires them to not only see and treat anywhere from 20 to 40 patients every day, but to also complete the staggering amount of unnecessary documentation and paperwork required for insurance coverage and billing. These appointments are often scheduled in 10 to 15-minute slots, leaving less than 5 to 8 minutes of actual face-to-face time with your patient. Each day feels like a never-ending battle of balancing being thorough with being efficient. As a fee-for-service physician, you find yourself spending more time looking at the computer and clicking boxes than you do actually looking at the patient in front of you. You are systematically conditioned to worry more about pre-charting quality metrics than to use your valuable time and expertise for real patient care. You find yourself playing the never-ending game with ever-changing rules of which code to select to get this lab, imaging, and medication covered by this patient's insurance. You can no longer simply order a test or a medication. There are so many hoops for you to jump through: prior authorizations, pre-certs, and the dreaded peer-to-peer, all of which require additional time that just does not exist during your day. As a direct primary care physician, there are no third parties making the rules and dictating the level of care you can provide for your patients. You have a much smaller panel and therefore can see far less patients each day with longer appointment times. This leaves more time for high-quality patient care, research, and communication, getting to the root of patient problems and doing more than just prescribing a medication and referring due to the lack of time. In direct primary care, both the patient and the physician feel confident with their health care and treatment plans and build a long-lasting relationship. The disturbing lack of price transparency in the fee-for-service healthcare system leaves physicians and patients unsure of what things actually cost. As a DPC doctor, you can offer extreme discounts on lab work at 80 to 90% less than the inflated insurance cost of labs. You can also coordinate price transparency with local imaging centers to obtain cash pay rates for 3 to 5 times less than what insurance charges. Cutting out the middleman of hospital administrators and insurance companies is key to delivering high-quality, affordable, and transparent primary care. If you're a doctor and you're interested in practicing medicine on your own terms with a better work-life balance, all while delivering to patients top-notch and affordable health care, stay tuned. I am Dr. Ashlee Hendry of Mid-South Direct Primary Care, and this is my DPC story.
Dr. Ashlee Hendry is a board-certified family medicine physician and boy mom of 3. She grew up in the small rural town of Stringer, Mississippi, and then attended undergraduate school at the University of Southern Mississippi in Hattiesburg, Mississippi, where she obtained her BS degree in biology with a minor in general chemistry. She then earned her DO at William Carey College of Osteopathic Medicine. After medical school, she and her family moved to Memphis, Tennessee, where she completed the unopposed UT St. Francis Family Medicine Residency Program in 2018. She continued to practice in fee-for-service in Tennessee for 2 years, and during the pandemic, she and her family welcomed a third son, and then soon after moved back home to Mississippi, ultimately settling in the city of Petal. She then practiced in the local community for 12 months before opening the area's first direct primary care clinic in March of 2022. She loves the work-life balance that DPC has given her. She enjoys spending time with her children and husband, Wes. Her hobbies outside of medicine and motherhood include art, fitness, and cake decorating. Welcome to the podcast, Dr. Hendry.
Thanks for having me, Marielle. I'm so excited. I feel like a total DPC newbie, and this is such an honor to be asked to be on the podcast.
It's definitely an honor from this end of the recording because you have over 200 patients and you only opened in March of this year. I'm so impressed by your tenacity. Please tell us a little bit more about Dr. Hendry herself. Where did you get started with medicine and how did you end up on this amazing journey to open and take care of over 200 people already?
Of course. Thank you so much. So I guess to really understand what brought me to the DPC community, you have to understand what drove me to be a physician to start with. I grew up in a very small rural town in Mississippi with my family, and I lived very close to my grandparents growing up. They both ended up passing away from cancer-related illness when I was 11 and 17 years old. So this was probably one of the most key driving factors in me wanting to be a physician was my experiences with their healthcare. As a child, I did endure some traumatic childhood events, which ultimately shaped me as an adult and ended up making me a better physician overall. As a teenager, I was a very lost soul. During this time, I wasn't even really sure if I wanted to go to college, but my friends all seemed interested, so I ultimately decided to go. Thankfully, there were some teachers that advocated for me in the system, and they told me, look, you've got to get a scholarship. You can take the ACT, and if you make a 30, you can have a full ride. So that was like kind of my goal is, I've got to get this 30. I ended up taking the ACT 6 times, saving my money every time and studying. And then once I got that 30, I knew I was in and I could actually go to college and have everything paid for. So starting out in college, I didn't really take anything seriously the first year, but thankfully my grades didn't suffer too much. By my second year, I decided I'm going to go to medical school. I'm going to make straight A's, have a great GPA. Everything was going great. And then I reached the beginning of my 4th year. I had planned on starting at that point to interview for medical schools, but the universe had some different plans. I found out I was pregnant with my son, Evan, that summer. And his dad and I really didn't stay together for much long after that. So I was pregnant, single, and a pre-med mom. This was definitely problematic in many ways. Not only was it like a very difficult time for me physically and mentally, but I also ran into some hesitancy and resistance from faculty members when it came to writing my letters of recommendations for my application. So I was really discouraged and I decided to kind of delay applying at that point and going ahead and just kind of getting my degree and then seeing what happened. Being a mom was really like the best thing that ever happened to me. It truly made me redirect my focus and want to do better for my kids than what I had. So it was the number one motivator. The first few months as a single mom, we struggled financially. I also struggled with anxiety and depression. And I'm really grateful for my friends and my family during this time because they not only supported me mentally, but financially. And because I did not have a job and I didn't really have anywhere to live. We were on food stamps, we were on government support. And so it was a difficult time. I did interview for medical school that fall and I realized pretty quickly I needed to find a job. So I was thinking, okay, well, I'll do something with my biology degree. I'll go work at a hospital and get some experience, which I found out very quickly is not really how things work. I could not find a job anywhere. They wanted prior experience, which I didn't have. I couldn't teach school because I didn't have a teaching degree. So I ended up kind of falling back on what I had known since being a teenager, and that was waiting tables. So I actually started working at the first Hooters here in Hattiesburg, Mississippi as a bartender when Evan was about 5 months old. As a single mom, I was able to make enough money to buy our first house. It was about $70,000. So I was able to show enough pay statements to get a loan from the bank to do that. I was also able to afford daycare. And then I found out I was accepted into medical school somewhere around the spring of that year while I was bartending. So that was just so exciting. I never thought it would actually happen, but it did. And I was accepted in medical school in the same city, so I didn't have to move, and Evan could stay there as well. I got him in a great daycare so I could see him during class. And then I began the first year of medical school that next fall.
I think about how when I used to be on the selection committee for new candidates to Creighton Medical School, what we really paid attention to was the life experiences that people brought to the table. Because I really think that when people have whatever experiences they have before medical school, that's what really, it frames your way of taking care of people, your way of appreciating people based on where they are when they show up on your doorstep or when they're in the exam room that you're walking into. So thank you so much for sharing that history. And it's incredible because you also are coming from a place of really being able to appreciate now advocacy on such a different level, because, you talked about like those teachers who were hesitant to write you letters of recommendation just because you were a woman who was pregnant at the time. It just ridiculous. And
Yeah.
As a mom, especially when you're taking care of families, you bring such a different perspective to the table. Did you decide that you wanted to do primary care at that time?
Yeah, so I always knew that I wanted to do something with primary care. I didn't really know for sure what I wanted to do going into medical school. But yeah, having Evan, I think, and being a single mom without a lot of help definitely changed my outlook on what potential residencies I was going to apply to. I wanted to look for ones who had childcare, because at the end of the day, it is such a factor in moms and dads and anyone in the workforce, doing the jobs they want to do, is like, well, where can my child be watched at? So I think that a lot of that decided where I applied. I ultimately ended up not matching in Mississippi. So I had to go through the scramble, which was just an experience all on its own, very stressful, and ended up matching at that point into Memphis, which was close enough to where I was still somewhat close to my family and friends, and my son, he could still see his dad. We could drive and meet halfway. So it wasn't impossible, but it did make things a lot more difficult.
In case there are medical students who are about to experience the scramble themselves, whether they expect to or not, what words of encouragement would you have for those people to get through the scramble and to continue on with their career calling to medicine?
Yes, I think the whole process with the match in general just honestly isn't the best. And I think there needs to be a lot of reform in that, but it can be devastating. And I remember just the overwhelming anxiety and just feeling like I wasn't worthy and I'll never really be a doctor. And at the end of the day, everything happens for a reason, and you're going to be placed in life where you're meant to be. So try not to worry about it too much and just try to enjoy the ride. It's very stressful, but everything will work out the way that it's supposed to eventually.
I love that. And on that note, things happening for a reason, you are now a DPC physician. And so I want to ask, when along your training did you find out about DPC, and when did you decide that, wow, this is the type of medicine I want to practice?
Yeah, so very early on. I remember being an intern in residency and just being kind of overall jaded with the system pretty early on when we started being introduced to billing and coding. And, we were told intern year, you need to see, up to 8 a day, and next that, 8.5 day and 16 in a full day. The next year, ramping up to 20, the next year, 24. And for me, that never made sense because I did not want to see that many patients per day. And I didn't want to pick all these codes and know which insurance covers this. So I was very close with the girls in my residency class. I mean, we were basically like family and sisters. And one of them, Elizabeth Maldonado, who's also a close friend still, she is the first person who ever brought up DPC to me. And she kind of explained it like, well, it's like private practice, but you don't take insurance and you're like a lot happier. So
that's awesome.
That was kind of my first introduction to it. And she's just one of those people who's just pure and she's a good person. So I know that if she has researched something and she thinks that it's a good idea, it is. And so that's kind of how I started hearing about TBC and looking into it. I joined all of the physician groups at that point, the DPC doc groups, and just started kind of looking back and watching posts and seeing other people open their clinics and DPC dreaming and thinking, oh, that's going to be me one day.
Awesome. And there's lots of people doing that same thing right now. And so hearing your story is absolutely adding to the experience that they're learning from as well. Now, I want to ask, what was life like in fee-for-service prior to opening Mid-South DPC?
Yeah. So fee-for-service in the beginning was tolerable, I would say. You go from being a broke resident to working 70, 80-hour work weeks, making less than minimum wage, and you're finally making enough money to buy your kids cool things and go on trips. And so the financial aspect of it can kind of outweigh the downside for a period of time. But eventually you realize that you're still not happy. And that was true for me. For me, it wasn't really, it was never the patients. The patients were always great. I loved them so much. I've always been really close with my patients. For me, it was the not having any say-so in my day, not having any say-so in which patient got which appointment time, because it's just some patients require more time and some patients don't require as much time. And I couldn't even make those basic decisions. And I think it's the same at all employed physicians in one way or the other. Of course, there are some that are worse than others, but you run into the same problems everywhere, just lack of autonomy and just the overall no price transparency. It just never made sense to me. Like, why can I not order a lab and tell the patient on the front end, hey, this lab costs this much?
Yeah.
Because even in training, we're told don't order this because insurance won't cover this if you haven't done this and the workup first. So all of these little things to me in fee-for-service just kind of added up to where I was just really unhappy, and just it affected my family life. I wasn't the best mom I could be. Even though I would come home and have my charting done, I was pretty efficient. I would still be thinking about patients that I saw that day. Like, did I really do enough? Could I have went a step further and listened a little bit longer to really get to the issue and not just order a test or refer because I ran out of time, basically. And so those kind of things just really weigh heavy on your heart, and you feel like you're just not doing the best job that you're trained to do. And so over time, it really got to me. And I didn't stay in fee-for-service very long. I think a total of not quite 4 years. And I think that I kind of knew initially going into it that it wasn't really something that I wanted to do forever, but I was willing to try it for financial reasons.
So once you decided that fee-for-service was not going to work out for you for the rest of your career, and you decided that Mid-South DPC is where you were going to be headed next professionally, what were the conversations like in your household? Because I really think that having not only price transparency in medicine, but also transparency with your partner is really important when you're making such a decision like this to open DPC. Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes.
Yes, that is a great question. And thankfully, my husband and I are best friends. We've been together for a really long time. And he's always known since I became a doctor and started looking at practicing options that the fee-for-service wasn't for me, and I wasn't really happy. And eventually I would end up doing this. It wasn't really on our initial timeline of what we had discussed. But again, everything happens for a reason, right? Mm-hmm. My husband had kind of stepped away from his job. He was a subcontractor and a carpenter. And he had made the decision, well, we made the decision as a family for him to stay home with our son when I went back from maternity leave. So just that whole process of spending more time with our baby. I got 6 months maternity leave. it really just changed things for me in general. And it pushed me harder to go ahead and do this. So I kind of gave him a heads up, like, look, I want to probably go ahead and start on this timeline. We need to save this amount of money. We need to have living expenses for 6 months because I was the only breadwinner. And so it was a family decision. The kids were involved too. Everybody was really excited and encouraging. And they honestly lifted me up when I didn't really feel like I could do it anymore. When I was nervous to submit my resignation, they were there and like, no, it's good. You can do it. You can do this.
Awesome. No, I love that. And I'm sure that's so relatable to other people who have pressed send on that email
it is
for
very nerve-wracking.
Yeah, I absolutely agree with that. No, because at the time of this recording, with the newness of DPC being so fresh on your mind, I want to ask, what are some of the things that you felt very prepared for opening Mid-South DPC? And what are some of the things that you felt you could have been better prepared for?
So I would say that I was very prepared overall with the space and the setup and like the aesthetics of the clinic. I was very pleased with how everything turned out. We did the entire flip ourselves and the vision was mine from start to finish. So I really feel like that turned out great. Things that I was not prepared for, I think would just be the overall business aspect of running a small business. You just don't really know what that world is like until you get in it. And it's a different world. There's like 100 million tasks that you have to complete every day. And so it's just constantly making lists and keeping up with things and being organized, setting auto drafts on your bills, making sure all of your applications are in, permits are in. So that is just a beast that you have to tackle head on and learn from experience. I also thought it was great having staff on day one. I think, and I would highly recommend anybody do that if you can, because for me, it made me be able to focus on more important things and less on some of the like paperwork and the phone calls, which can really wear you down when you're trying to do a whole lot in a short period of time.
And when you talk about flipping the space, can you give us a little bit of a picture as to what was your space before moving in and how exactly did you flip it? And what does it look like to the patients when they walk into your clinic these days?
Yeah, so we are very, very proud of our space. It is actually, and this is going to be my boy mom showing, it's about 3 football fields from my house. So super close. And I honestly don't think we could have done it had it been at a different location. 1,250 square footage. I ended up getting an absolute dirt cheap deal, like $800 a month is what my rent is. So you cannot beat that. The space before at one point was a donut drive-through store. It was a tanning salon. And most recently it was like a children's boutique about 4 years ago. So yeah, I signed the lease. Okay. Well, I gave my 30-day notice at my former job on the 17th of January. And then I signed the lease on the place about 4 days later. So at that point, it was, let's get the keys, let's get rolling, and let's go. I was still working for the next 30 days. So obviously I had to have a team kind of come in and help me. And that team consisted of my husband, who was such a trooper. I mean, it was his time to shine. Every day when I get home from fee for service, we would like exchange the kid. He would put on his work clothes, head up to the clinic, and he did the whole build out pretty much. So the nurse practitioner that I work with also helped him as well with certain things. And then on weekends, I would come paint, decorate, do the interior design, and get ready with all the marketing materials. So it really was like a family affair and everybody kind of pitched in. The older brothers helped babysit as well. So we could have time at the new space to get everything ready.
Awesome. I love that. And in terms of the pieces of your space, I want to highlight your signage because you've posted about your signage in the Facebook groups in terms of like what your amazing sign looks like. And it's prominently right there when you walk in. So can you tell us about how you got your signage up in your space while doing this build out?
Yes. So I'm also very cheap, full disclosure, and I'm also into DIY. I did not want to do my own sign. I felt like that needed to be something professionally done. So I was willing to splurge, but not that much. I ended up finding like a great company on Etsy, and I can't remember the name right now, but it's a family-owned business, and I'd love to get that to you so you could add that. I don't know how that would work, but they did my interior acrylic sign for less than $400, and it's right behind my front desk when you walk in. I think it's very beautiful. It looks super professional. And then my outdoor sign it's on a metal square, and it's also acrylic and vinyl. And so it was like right at under $700 total for that one. So I ended up saving a lot of money and getting two great looking signs. And in a short period of time, they were both shipped and created within a matter of weeks.
Amazing. And just, I love the, like you said, it's go time, like we got to get this done. And you have definitely done that. Now, in terms of you're getting your space ready, you're getting ready with all the marketing stuff. What were some of the initial things you did for marketing to build up momentum to get patients to join on day one?
Yeah, so I gave a 30-day notice at my former job, so I did not have a lot of time. I actually could not tell any patients really what I was doing or that I was even leaving. So I basically just decided to make a public Facebook post on my personal page and just to kind of let, all my friends and family know, hey, these are the new changes that are coming right now. This is what I'm doing. I'm opening this new clinic and this is why. And I kind of listed out the reasons that I've spoken about on this podcast about why fee-for-service leads to physician burnout and leads to overall poor patient care. And I think it really resonated with the community. I think a lot of people saw it. It got shared a lot and liked a lot and posted in local community pages. And I think that people really appreciated the authenticity and me just being honest about why I wasn't happy with my former job and why I was really excited about being able to do something new and different.
The DPC Summit in Kansas City is coming up July 15th through 17th in Kansas City, Missouri. Show your love for DPC and get your DPC swag on. Find DPC t-shirts, mugs, buttons, stickers, and more over at the swag shop at mydpcstory.com today. In terms of opening day, when you look back at things that were needed and things that you were missing on day one, can you touch on that in terms of what it looked like for your clinic supplies wise, or any tech that you had in place or that you wished you had in place? Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
I guess the biggest thing that I wished I had in place was to submit the CLIA waiver application faster. I had no idea that there was like a delay on that. And so I kind of waited to the last minute. I had already ordered the testing supplies, but then I realized that there was like a 2-week turnaround on the waiver. So I called the state and I was like, hey, is there any way we could speed this up? I was really planning on opening next week. The lady was just super helpful and she ended up pushing it through for us and had my CLIA waiver emailed to me on the day we opened. But that would be one of the things I would recommend doing a little bit sooner than the 2-week before opening mark. But other than that, I think that everything, you end up having this kind of like a never ending list of things that you have to do and things to order. I did find a refurbished EKG machine before I opened, so I went ahead and got that. I waited on certain in-office injectables and certain more expensive things that we really couldn't afford in the beginning, testing supplies, et cetera. And we would order a small amount. And now that we have kind of ramped up patients, I'm getting a better process of ordering supplies and knowing what's due and keeping up with the lab requisitions for supplies for that as well.
Yeah, I think that's a really big gem there, the advice on CLIA waivers, because it really is state dependent. California has a very amazing, and I say that in a facetious way, CLIA application process. And so it took me about 6 to 8 weeks to get my CLIA waiver. And so I definitely would say as soon as you get that, the CLIA waiver lasts for a long time. So you can definitely, start applying for that as you're thinking about DPC. And now I want to turn to your patients because you are near Hattiesburg, and Hattiesburg is known for the Hattiesburg Clinic. And I want to ask, what do patients, like you mentioned how people were so impressed with the authenticity with your mission and they were spreading the word. But I want to ask, what is the perception of healthcare like locally, and who are the people who have appreciated what you're doing and who have joined you at Mid-South DPC?
Yeah, so that's a great question. I think the perception of healthcare locally is similar to everywhere in the United States, but here in particular, there's not any sort of DPC clinics around this area. And so I think a lot of patients have struggled with kind of grasping the concept of we don't really take insurance and we don't need insurance and we're better off not using insurance. So it's been kind of fun for me in a way to sit at the front desk and talk to everybody when they come in and kind of give them the rundown on why we're doing this and what the difference is. But overall in the community, I think that there is just a growing unrest of people who are questioning things, who are looking at bills, who are wondering why they can't see their physician for weeks at a time, who can't get their doctor on the phone when they're sick. So there's been a lot of that, and there's a lot of unanswered questions. And so I feel like patients are looking for different options. And if they look just a little bit hard enough and find us, I can explain to them what the difference is and why it's better. We have had some absolutely amazing patients join. We've had teachers, farmers, lawyers, doctors, graphic designers, engineers, professional athletes, pastors, and many small business owners and parents. We've had some great kids join as well. And of course, we've had a lot of arts and crafts enthusiasts join, which tend to be my favorite type of patient just because I love talking about it with them. I've even kind of dedicated an entire wall to those type of patients. Anyone who loves creative things, who likes to make things, they are welcome to bring it in and we can hang it on the wall and just kind of showcase everybody's talent that has joined the clinic.
I love that. And one of the things I want to ask if you can highlight too is your own contribution to the art pieces in your clinic.
Yeah, so art has probably always been my first love. I love all kinds of art, whether it be painting, drawing, cake decorating, doesn't matter, anything creative, that's my jam. So for the clinic, I did all of the artwork. My best friend Bethany came and helped me do some abstract stuff 2 nights before we opened. So we were up there really doing things quickly and having a lot of fun. I was able to paint a mural on the wall with our logo, which I think is very special. And when patients kind of realize that, oh, wait, the doctor painted all this, that's just an extra layer of something cool about the clinic and something unique that you have never seen before.
Love it. And as a DIY fan, I'm so excited to hear this about your clinic. And I definitely would encourage you guys to check out the website at Mid-South DPC to see this amazing art that Dr. Hendry is talking about. One of the things that I had learned about you before this interview was that you had a presence when it comes to social media prior to opening DPC. So I want to ask if you can share a little bit about that, and how did that allow you to know how to market when you started, so you knew what kind of dialogue you wanted out there that patients ended up sharing?
Yeah, so back in medical school, I would consider myself kind of a low list Instagram fitness influencer. I got really into fitness my second year of medical school and actually kind of made the decision that I was going to do a bodybuilding competition at the end of that year. So I spent the year working out every single day, counting my macros, weighing everything. And I really pushed my body to a limit that it had never been before. I lost a significant amount of weight. I was able to tone up and gain muscle. And so really got into the fitness aspect of health. And at that point during medical school, I had a pretty decent following. I had like right around 60,000 Instagram followers and like 30,000 Facebook followers who were also kind of interested in my story and my transformation. And then the single mother who made it to medical school and who's also really into working out. So that was really cool. And I actually ended up using that to my benefit with the new clinic. I did not have access to my Instagram anymore. I lost access to those followers, but I did have access to my Facebook fitness page. And I was able to regain that and kind of delete the old content and flip it over to my DPC clinic page. And now I kind of have a built-in following of people who I can send things to on a marketing standpoint who are also interested in my content.
Incredible. And love that that is such a unique way of harnessing a pre-existing social media presence. So I love that. And in terms of the people who have joined your practice. Again, you have over 200 people that you are taking care of already at Mid-South DPC. And I want to ask, how was the onboarding process at day one, and how is it going?
So I was not ready. Full disclosure, I did not expect that amount of people to sign up and definitely wasn't ready. But again, hiring my nurse on day one, his name is Dustin. He is just a godsend. He is so amazing. He was able to help me get patients scheduled. In the beginning, I was kind of calling them myself and reaching out. And I found that I was on the phone from like 7 a.m. until 7 p.m., literally calling patients all day long. So once Dustin came on board, those first couple of weeks before we opened, we were able to get most of the patients scheduled. And then I would say really up until about this past week, things have been kind of hectic and seeing a lot of patients every day just to get everybody in, and then also enrolling new patients, a couple every day as well. But it's been a good amount of busy, and it's still less than what I was seeing in fee for service. So at the end of the day, 12 seems like a lot in the beginning for DPC, but it's really just getting everybody in and kind of having everybody see the space. And then things get easier on follow-up visits.
Definitely. And when you had the floodgates open and those patients were onboarding right away, how did you strategically, between you and Dustin, schedule them so that you were able to pivot if you needed to take care of something acute that happened?
Yeah, so everybody for the first visit is always scheduled for an hour. I'm just very thorough and OCD, so I like to pull hospital systems from both of the local hospitals and look at like 10 years worth of imaging and trend all of their labs if I can. And so just to really get like a good first visit, I think it's important to have an hour with every patient. So what we did was we would have a list of the pending enrollments and the new enrollments, and we would just get a highlighter and print it off every day and just go through, and we'd make little notes. This patient called, no answer. Of course, there were people who signed up in the beginning who ended up not actually joining the clinic. I've never required a credit card for enrollment. That was kind of a strategic decision I made because I did not want anybody to not sign up because they were spooked about the idea of putting their credit card information online. Mm-hmm. And what I found was that it also gave me an opportunity to talk to people directly and kind of answer any questions they may have. And of course, everybody had a few questions, with one of the main ones being, do you take insurance? And so I got to kind of explain why I don't. And this is why, and this is what you get for your monthly membership fee in the place of having insurance and billing your insurance.
When you had your workflow in place to get everybody onboarded, in terms of reaching out to not only potential patients, but to your community, how did you reach out to people like drug reps or other people in the health realm, like fitness instructors or podiatrists, those types of people? How did you reach out to your community in addition to potential patients?
Yeah. So again, it was mostly just kind of through social media. Like, we really haven't done any sort of targeted marketing other than just a few Facebook posts, but word of mouth traveled really quickly. And the community pages, there seemed to be a lot of traffic about people wanting to know if there were any new doctors in the area or where they could get in to see a PCP. Even though there's a lot of access here, people still can't find a doctor that can see them in any sort of time frame. Yeah. So I think we got a lot of word of mouth that way. And then also people would just kind of come in to see what we were doing, right? So we were in a shopping center, people would drive by, pull in and, hey, what's this? We could kind of explain at that point, hey, we're a new type of clinic, and kind of like concierge medicine, but a little bit different. They could kind of grasp that word of concierge. So they knew that was a little different as well. So they kind of separated us from fee from service. But yeah, and just like the local fire chief, I ended up finding out we're actually distant cousins. So he's been in a few times. And, word of mouth, it's a small, very close community. People talk to each other. They go to church together. When they're excited about something, they want to tell others. And it's really just been word of mouth and a few Facebook posts. So when it came to the vendors, I had worked in fee for service in the same town for about a year. And so I was very, I knew the vendors, they knew me. Some of them, pretty much all of them, found out that I was no longer at my former place of employment. And so they reached out either on social media, or they had my number, or David, my nurse practitioner's number, directly. And so what we did was we had kind of like a vendor pre-opening day, the day before the clinic opened, for everybody to come and bring samples for the new clinic and help us stock our sample closet and take a look at the space. And yeah, kind of explain to the vendors as well what DPC was, and just pique interest in that way, because then they also went to other clinics and they can kind of spread the word as well.
I want to highlight that you had a ribbon cutting ceremony, and, we're just at the time of this interview really starting to get a lot of in-person things that we haven't had for a while. So tell us about your ribbon cutting. How did you get people to attend and what was it like?
Yeah, so the ribbon cutting was really fun. The Chamber of Commerce, they reached out to us pretty early on. They were very interested in the concept of the clinic. So we ended up joining, and then they provide a ribbon cutting ceremony as part of their chamber package. We scheduled it, and we did not really advertise a lot because it was after clinic one day, and I just kind of wanted it to be close family and friends. So we did have a lot of people that ended up showing up that day just to kind of support us. I did give a speech, and this was my first time speaking in public since the pandemic. Public speaking is not my favorite, so I was very nervous, and I was glad that all of my boys were there and they could see me giving that speech. And my oldest, he ran up to me immediately after I was done and gave me a hug, and it was just such a great moment for me. And I asked him later, I was like, well, what made you do that? And he was like, well, Mom, you just looked really nervous and I heard your voice cracking. And so it was just it was a great moment for me and for my family to kind of overcome that fear of public speaking and just to do something big, like open your own clinic.
Amazing. And it reminds me of talking with Dr. Amber Beckenhauer. She's also a boy mom and has 4 boys herself, but just when your kids see you being an entrepreneur and being able to take a problem and fix it because you can, when they see that growing up, they're going to learn those skills without knowing it. So I really think that's awesome. And in terms of the staff, you mentioned how you work with Dustin and then you also have David now. How did they come to join Mid-South DPC?
Dustin is our LPN and David is the nurse practitioner. And I met both of them at my former fee-for-service job. Thankfully, when we first opened, I posted the position online that we were ready to hire a nurse on day one. Once I saw that we could cover overhead, I was like, yes, let's hire a nurse immediately. So Dustin, he applied for the job and I was so thrilled to have him. He's just amazing. My patients love him. People literally scream and jump up and down when they walk in and see him behind the front desk. I mean, he is just really great. So he's been a huge asset. As far as David, we worked together for about a year and he's a great provider, a great nurse practitioner. And he had been practicing in the community for about 3 years prior to opening the DPC. So he had a very large following. Patients were looking for him online. There were hashtags going around like, where is he at? Nobody can find him. So it was very exciting to be able to talk to him and just say, hey, there's this new type of clinic that I think we could open and be successful and not take insurance. He had never heard of DPC before, so he really just kind of had to go out on a limb and trust me with it. But I was like, look, we can either try to take insurance and play the games and get less and less reimbursement, or we can just jump out on a limb and do this, no insurance. So we did. And we just had discussions early on about what we wanted the practice to look like and how we kind of wanted things to be laid out. And so that's how we ended up kind of going in on this endeavor together from the very beginning.
And when you look back at this whirlwind that you have been through, what do you appreciate now about life that you wanted before, but you couldn't necessarily attain?
So I think that I've just finally been able to find joy with what I do with my job. And it's so important to have a job that's fulfilling and that just isn't toxic. And I didn't really realize that until I got out of that environment. Even my kids notice. They're like, Mom, you're smiling again. You're singing songs in the car. You're kind of dancing again. You're fun again. You're happy again. And so when my children started noticing it, I was like, you know what? I've really made the right decision here. I sleep better at night. I am more outgoing. I'm less stressed. It's just been a truly life-changing experience for me. And I wish I had done it years ago, honestly, or straight out of residency. But again, everything happens for a reason. And I think the timing was perfect. And the team I have now is just, it's great. My number one thing that held me back from opening the DPC to begin with was not knowing if I could share call with somebody and being available 24/7 to patients and not being able to take a vacation. So for me, kind of having someone to partner and open up with was always very important. And I think that thinking outside of the box and opening up with a non-physician provider was something that I had never thought about doing before, but ended up being a really great situation for us. And it kind of helped me have that coverage so I can get away and spend time with my family and take a vacation. and that I also have somebody else to kind of help me out through this process if things were to go bad, and to also kind of help me celebrate when things do go well.
On that note, I want to close with asking, what does the future hold for Mid-South DPC?
So the future is bright. I have so much more time now to do creative things. One of the things that I'm very proud of and excited about is a new fitness program that I've written for the members of the DPC. It kind of is an overview to weight training and cardiovascular exercise and the basics of fitness. And I feel like it's something that's lacking in a lot of patients' education and in general with physician treatment options. We don't really speak about that a lot. So I'm excited to be able to teach patients how to work out and how to enjoy fitness, because it really can help with all of the things, all of the medical issues, all of the mental health issues. It's a great tool to have. We're also working on employer packages. I'm very excited about that. Have not quite had enough time to get something set up and materials ready, but in the next week, we do start having appointments with different small businesses that we're going to start reaching out to. So that's also coming in the future, and I'm really excited about that.
Amazing. And I just want to highlight on your website how you have employer packages mentioned and you have the note coming soon. I love that, because if you're like yourself and you're just ballooning from the get-go, it's a way to get the word on the street that it is coming, but stay tuned. So I love that. Well, thank you so much, Dr. Hendry, for joining us today.
Thank you so much for having me, Marielle.
Next week, look forward to hearing from Dr. Allison Edwards of Kansas City DPC in Kansas City, Kansas. If you've enjoyed the podcast and you haven't yet done so, subscribe today and share the episode with a physician you may know who needs to hear about DPC. Leave a 5-star review on Apple Podcasts and on Spotify now as well, as it helps others to find all these DPC stories. And lastly, be sure to follow us on social media. If you're wanting to continue learning more about DPC in the meantime, check out dpcnews.com. Until next week, this is Marielle Concepcion.